Hello and good afternoon once again. Ask the gynecologist here, Dr. Alalade. And I'm sorry that I came a bit late today. I wanted to come up very much earlier, but I had a phone call with a client. And honestly speaking, when people start to talk with you, you feel for them. You can see what they are going through, and you identify with their personal concern. And it's not always easy for you to disconnect the phone call till you have finished the conversation. So good evening, everyone. Once again, your one and only Dr. J at Ask the Gynecologist, and it's my pleasure to be with you tonight. I'll be talking about hysteroscopy and Asherman syndrome. I'm hoping everybody can see my board here, and I'm hoping my board is not causing too much obstruction at all. So let me bring this board a bit closer here. I don't know if people can see me clearly on Facebook Live. So yes, so I think people can see me now on Facebook. Alalade here at Ask the Gynecologist, and I'll be talking about Asherman syndrome and hysteroscopy. People need to know what this is because people are a bit confused about what hysteroscopy is, what HSG is, and what Asherman syndrome is. I was talking to a lady today while I was at work. Obviously an ATG member in ATG, one of our premium services, and I realized that this lady did not even understand what hysteroscopy is. It's not unusual, that can happen, but my job ultimately is to ensure that I carry everyone along, and I should ensure that people understand what these things are. Once again, good evening once again to everyone. My name is Dr. Alalade at Ask the Gynecologist, and I'm so happy that our Instagram channel is live and up and running, and our Facebook channel is also doing excellent. And we also have our YouTube channel now. On the YouTube, we put up all our videos in a kind of sequential pattern. I know I've been a bit busy these days. I've not been able to update the YouTube section because it's been a busy time for me, obviously with baby now. But in the next few days, I will keep on updating our YouTube channel with our YouTube videos. My name is Dr. Alalade, one of your team members here at Ask the Gynecologist, and I'm so happy to be with you today. Over last week, we talked about sex, how to improve our sex lives. If you missed that video last week, you should go and watch the video now. We talked about action, part 1, part 2 on Friday, and on Saturday last weekend. It was back-to-back fire, buzz, heavy things. So if you did not partake in that session, you should go and watch that video now. If you're watching me on the Instagram, don't request to join. If you request to join, I'm going to add you. A lady was joined last week when we were talking about sex, or last week Friday or so, and she came up here live asking questions, and then she said she wants the video deleted. I'm like, how did you come up live there before? Did we force you there? Kai, come out there. Anyway, good evening everyone. I hope everybody can hear me. If you can hear me, give me buzz there. Karimot Aileru Rita Kelly Egbo Inola Yimeka Ajoke Akeredolu Patricia Eken from Mauritania, Gloria Konji, one of our moderators, Linda Njoku. We got Uju Asogwa, Inyama Momo. We have Uju Asogwa Akpangbo, Christina Oladumoyedo, wonderful lady. We have Ada Mbanisi Obiora. Patricia, if today is your birthday, I celebrate you all. For people doing anniversary today, I want to say happy anniversary. One of our moderators here, Lily Baturi, today is her wedding anniversary. I want to say happy wedding anniversary. And to one of our moderators as well, today is her birthday. I want to say Chitima Anyawu, happy birthday. I can get Bas from Christina. Christina is already giving Bas there from Nigeria, and Bas to back again to Inoluwa Yimeka, and we got people alive here. Linda Okoye, how are you? And thank you so much for being here. Once again, I want to introduce myself to you all. My name is Dr. Alalade. If you're watching us live on Instagram, thank you for being here. And if you're watching me on Facebook, I say thank you. And if you're watching me as well on YouTube, I want to say love you all. Thank you so much. Ayomide Baz. Ayomide Ayodele, Afsat Abubakar, and Linda Njoku. Your princess is doing fine. Your princess is doing beautiful. I have not had time to carry her since I came back from work. You know, I had to eat first. Then I had this phone consultation with one of our platinum services member. for the platinum service, we do video consultations. So I wanted to go live, and then the thing came. So somebody is ready to listen. First of all, the difference between hysteroscopy and HSG is very clear. HSG, which people do very common, is hysterosapingogram. HSG is an X-ray test. HSG is an X-ray test, okay? HSG is X-ray test, okay? HSG is an X-ray test, okay? Hysterosapingogram, HSG, is X-ray, okay? We also have hysteroscopy. Hysteroscopy is a camera test. Hysteroscopy is when we put a camera in and we look into your womb cavity. So this lady asked me, are they not the same? They are different too. During HSG, let me take the model, but let me draw here. Unfortunately, I think my board might cover some few things on Facebook, but I'm going to come here. Okay, let us use our board to explain what HSG is. Most of you know HSG is simply designed to check if the tubes are open or closed. HSG is designed to check if the tubes are opened or closed. And HSG is an X-ray test. There are many tests available in the world to check patency of the tube. There are many tests we can do to check patency of the tube. One other test apart from HSG is laparoscopy and dye test. Laparoscopy and dye test, we put you to sleep. While you are asleep, we flush in a blue dye. Okay, so this is your womb. Quickly. Tube, ovary, like that. So while you are asleep, okay, we flush in a blue dye into your vagina that goes into your womb cavity. And the dye goes through into your tube on this side, into your tube on this side, and it spills out into your tummy, into your tummy. We see it with our naked eye. That is laparoscopy and dye test. Laparoscopy and dye, D-Y-E. Laparoscopy and dye test. So while you are asleep and we've done that, so one doctor will be pushing the dye from vagina inside, okay, straight away in, and the other doctor is putting a camera through your belly button to look into your tummy while you are asleep, and we see the dye come out through your tube like that into your tummy, or we don't see dye at all, or we see dye collected in your tube and causing distension in your tube, and the dye is not coming out. If we see this second case, the dye forming a bulb in your tube and it's not coming out, that means that particular tube is blocked. That is laparoscopy and dye test. It's also a test of checking whether there's blocked tube or not. That's laparoscopy and dye test. HSG is X-ray test. We push in a fluid, what we call a contrast fluid, into your vagina. It goes in, it's like water. It goes in through the tube like this one as well. Goes in through the tube again. We take X-ray and then we see the dye coming out into your tummy on X-ray. The body absorbs the dye. HSG can be uncomfortable. You should take painkillers before going for HSG. HSG can be uncomfortable. So you must take painkillers before going for HSG. Very important. We also have hysterosonogram. It's a scan test, but we use saline to distend the womb and to distend the tubes. And we use ultrasound. So we use a camera as well, to check if the tubes are open. So the saline hysterosonogram. We use saline to distend the tubes and we follow with a camera, okay? That camera is like hysteroscopy, very similar, to check if the tubes are open or closed. It's a bit expensive. It's available in Nigeria now and available in most Western countries, Western part of it. So it's available too. And there are other tests, so on and so forth. Now, HSG is different from hysteroscopy. What is hysteroscopy? Hysteroscopy is just a camera test. Doing this, let me clean up this stuff on the whiteboard. Hold on. Because people get confused with all these names, and it's not unusual for people to get confused because these names are very tongue twisting and mind boggling, to be honest, because they are our own medical term. It took us years, even doctors, to understand these things. Okay, most doctors that are not in this area to shout it. They don't come to grasp with all these things sometimes. So this is your womb, okay? So let's make it a bit bigger. This is too small. Our almighty womb should not be too small. So this is your womb, this is your womb, this is your womb. Just a tube, ovary. Okay. So hysteroscopy, okay, let's put this hysteroscope camera like this, okay? That camera, it's got some lens at the tip, and also got some mechanism where we can push in water. So that water goes into your womb cavity, okay? It distends the womb cavity, and we can see the womb cavity. Sometimes if there's scar tissue from previous infection in your womb cavity, from previous or multiple DNC, from previous chlamydia infection, from previous maybe coil that has been there, or from previous C-section that was not done properly, and you have scar tissue in your womb, or from some bad DNC that was done, and you have plenty scar tissue in your womb, we will see all those scar tissue like cobwebs in your womb cavity during hysteroscopy. And hysteroscopy comes with many things, with scissors, where we can push in the scissors from bottom here. The scissors will go in, and we can cut away most of the scar tissue, Asherman syndrome there. And also too, if you got polyps are like fleshy skin tags. They look like this. Okay, so in your womb cavity, okay, let us take away this image here and draw another one. So in your womb cavity, good evening everyone, good evening. So this is your womb cavity, this is your tube again here, ovary, this is your womb cavity, and that. So this is not the perfect diagram, but just follow me. So in the womb cavity, you got something like this. It's like a polyp. It's like that, okay? It's not fibroid. Fibroid is like that, okay? This is like a polyp. It drops down. It's got a tiny base. Polyps can be taken out during hysteroscopy. We just cut off the base, boom, and we take it out. The same thing too if you have fibroids in the womb cavity. We can take it out during hysteroscopy. We can also take out a coil, marina coil that was embedded or misplaced in the womb cavity during hysteroscopy. Hysteroscopy, you can use it to take biopsy. But before you go for hysteroscopy, we need to take swabs to check for infection. Just the same way we take swabs to rule out infection before you go for HSG. You must take some painkillers as well before you go for hysteroscopy. And also, it's very important that before we do hysteroscopy, you should have done your cervical smear. Cervical smear is a test you do regularly to check for cancer cells on your cervix. Your cervix is the part of your womb that opens into vagina. Okay, when you put your finger into your vagina, or your husband is doing the do and is eating the roof, is raising the roof, and I'm saying yeah, it's like if you are pushing. She was saying that as if her womb is coming out of her mouth. That is the cervix you are eating. As a guy, when you eat the cervix too much, it's as if the woman wants to vomit during sex. So cervix is what you feel when you put your finger into your vagina and you feel that soft substance at the top of your vagina. That's your cervix. Before we do hysteroscopy, we must make sure that you have your regular cervical smear and there's no cells that could be of cancer nature on your cervix. During hysteroscopy as well, we can take biopsy of your womb cavity. Hysteroscopy too, during hysteroscopy, we can take biopsy of the womb cavity to check for infection, to check for diseases, to check for cancer or anything. Okay, I know cancer is very rare in the age group of people watching me. Cancer is very unusual and very rare in people watching me. Most people watching me today are less than 50. You are trying to get pregnant. You're less than 50. You're unlikely to have cancer. But hysteroscopy can be used for people above 62 to check if they have cancer, if they have any disease. Because if you're having a regular period, and your period is not regular, we've done your hormone profile is okay, but despite that you have a regular period, two things you must consider doing is to do cervical smear test to check for any cancer cells or diseases on your cervix. And the other thing you must consider doing is hysteroscopy, where we look into your womb cavity. Like I told people all the time, hysteroscopy machine is going to be available at the ATG IVF Center in the next 2 weeks. We've already purchased an equipment for hysteroscopy now, where we can look into your womb cavity, we can take away Asherman syndrome, we can find out possibly why pregnancy is not implanting. We can find out so many things by doing hysteroscopy. Even doing hysteroscopy, we can even find out people that have got what we call biconate uterus. If you got abnormal uterus, we can detect that as well doing hysteroscopy. So I'm trying to tell you down that hysteroscopy is basically to look into the womb cavity and to detect any abnormalities like scar tissue, fibroid, polyps, cells that are probably of cancer nature, and to treat them at the same time, to take them out. During hysteroscopy, you can remove fibroid. You can't remove fibroid that is in the womb cavity during HSG. During hysteroscopy, you can take out polyps. You can't remove polyps during HSG. During hysteroscopy, you can take biopsy of the womb cavity. You can't do that during HSG. HSG is designed solely to look into the fact that are the tubes open or closed. And if you've been trying to do IVF, your IVF is failing, you've done one or two IVF and it's failing, you must consider doing hysteroscopy to check your womb cavity to see if there's something unusual going on. In fact, if you have one IVF and it's failed, you should be considering hysteroscopy. Okay? Or if we are anticipating possible difficulty with your hysteroscopy, with your IVF, we should consider hysteroscopy even before we proceed for IVF if necessary. Okay, but before you do hysteroscopy, ensure you do cervical smear test to rule out infection, because we don't want to push infection hiding your vagina inside your womb to go and cause more havoc. We want to check for infection in your cervix by doing cervical smear. That is very important. Okay, we must do tests, smear test, swab test to check for infection in your vagina before we proceed and do hysteroscopy. It's also very, very important that we do cervical smear test, that you've done and you're up to date. You've done and you're up to date with your cervical smear test before doing hysteroscopy. Okay, and it's important that you know that hysteroscopy is not to check the tube whether it's blocked or not. Hysteroscopy is to remove or diagnose any problem in your womb cavity. In what? Your womb cavity. I'm going to open the floor shortly, but before I continue, I want to tell you something about an infection that causes miscarriage. I've spoken about that before. If you've had miscarriage before, two miscarriages, three miscarriages, you should get investigations done. And one of the infections that should be checked out if you're having recurrent miscarriage is do vaginal swabs to check for what we call bacterial vaginosis. Bacterial vaginosis is very notorious and is known to cause infection in the water that surrounds the baby that can lead to miscarriage and can be recurrent. Recurrent means it can affect subsequent pregnancies. So if you've had miscarriages before, you should ensure that they do vaginal swab tests to check for bacterial vaginosis in your cervix, in your vagina, in your womb. And if you have an infection like this, it should be treated before you get pregnant again. Bacterial vaginosis is very notorious in causing miscarriages. And in fact, if you're trying to get pregnant, one of the tests you should do is vaginal swabs, high vaginal swab and low vaginal swab, and endocervical swabs to check for infection. I'm going to explain to you today what these three different swabs mean in vagina. In the vagina, you can do high vaginal swab, low vaginal swab, and endocervical swab. So now listen to me. This is very important, okay? You should listen attentively now to this topic. And these are the reasons why people have miscarriages or they have PID, because they don't know. Knowledge is what separates you from the person that has something and the person that doesn't have something. The person that is suffering from something or the person that is not suffering from something. Knowledge is that gap. And it's not knowledge alone. Knowledge that you use that turns to wisdom. If you don't use knowledge, it's useless. See, if you don't use knowledge, it is useless. Knowledge that you use is what God uses. If you have knowledge of something and you don't use it, is useless. What you know that you use, that you practicalize, is what God is going to use to change your situation. If you're listening to me today and at the end of the day, you're still not going to change or to correct what you're doing, then there's no benefit of you listening to me. If you're going to listen to me, then it's always good for you to use what I've said to change your life. Now, let's talk about different types of vaginal swabs. Now, this is your vagina is always pink. We know that. So I'm going to use red to clarify and to describe the vagina. Now, this is your vagina, okay? Okay? That opens outside. At the top of the vagina is your cervix, okay? And the cervix has a hole like this. The cervix is what opens or is the entrance into the womb. Okay? The cervix is the entrance into the womb. So this is your womb. Okay? Okay, and this is vagina. Vagina comes in different sizes and different shapes. So some vagina, they can contain a ratio. Anyway, let's continue. So we can take swabs from this area of vagina. That is the low vaginal swabs. That's LVS. We can take swabs from this area of vagina. That is the high vaginal swab, HVS. And we can take swabs from this area of the cervix called endocervical swabs. We look for different organisms at different parts of vagina. Okay, for people that are looking for or trying to treat, importantly, actually, we should take swabs from all this area of vagina. Endocervix, high vagina, low vagina. Whenever we are looking for GBS, group B streptococcus, which is very common to cause miscarriages and cause early death of babies that are born full term. GBS, group B streptococcus, we look for them in the low vaginal area with low vaginal swab. If we're looking for other infections like bacterial vaginosis, trichomonas, and all so on and so forth, we look for them in the high vagina, including thrush in the high vagina area. If we're looking for infections like chlamydia or gonorrhea, we take swabs in the cavity of your cervix. So we put the swabs high in the area of the cervix there, okay, as it opens into the womb. We look for chlamydia and gonorrhea there. So there are different areas of vagina that different organisms stay. So if you're looking for different organisms, we take swabs from different areas. So you should have ideally 3 vaginal swabs. So in gynecology, we call it triple swabs. Triple swabs. Triple swabs, triple vaginal swab. Okay, we must do, if we are taking swabs from your vagina, we should take swabs from all these areas: the low vagina, the high vagina, and the endocervical swabs. Okay, to check for any organism so that we don't miss any organism. It's important. If that's not been done for you at any time, you should always ensure that they do that. Okay, on that note, I'll close this lecture. I'll start taking questions now, and I'll close this lecture for today. So let's start taking questions now. If you have any questions, let's do it. Thank you, Christina, for moderating. Thank you, Christina Ladumoye Idowu. God bless. Thank you so much. God bless you for moderating. And for all our other moderators listening, thank you so much. Ayola Bisola is asking that after hormonal test, can excess progesterone lead to miscarriage? No. Excess progesterone does not lead to miscarriage. Progesterone is needed but for early pregnancy support of your baby. Until your baby gets to 12 weeks, baby formed in the first 12 weeks of pregnancy, they rely on progesterone you produce to support them until the placenta is able to support and produce its own progesterone from 12 weeks onwards. Okay, so progesterone does not cause miscarriage. In fact, progesterone is very, very important to prevent miscarriage. Okay. Thank you, Christina. So if you have any questions now, put them up on the screen. Let me take your questions, answer them before we move on. There's a question from Chibuzo Queen. Chibuzo is saying, good evening, sir. I have been spotting for weeks now. I have done scan and small fibroid and ovarian cyst was found. You did infection test, urine result was E. coli, and vaginal swab was negative. So you should do cervical swabs. You should do cervical swabs. It's important to do cervical swabs at this stage, and also do endocervical swabs. Okay, cervical smear test for you, Chidima. Cervical smear test and endocervical swabs. Okay, very important. Can rhesus factors cause miscarriage? It can cause miscarriage usually in the second trimester, not in the first trimester. Rhesus incompatibility, we call it Hope Kingdom Daniel. Rhesus incompatibility can cause miscarriage usually in the second trimester, not in the first trimester. Doctor, what is big uterus? Big uterus is like somebody is tall, somebody is short. Now, you can have big uterus basically because the womb is big and distended, because the womb is just big. Like some people are tall, some people are short. And you can have big uterus from you having fibroid in the uterus. So we need to know what is causing your big uterus. Is your uterus just big because it's naturally big, or is it big because you have fibroids and other things going on in your womb? Somebody's asking, between hysteroscopy and laparoscopy, it's gone. That question is gone. Oh, child. Somebody is asking a question on hysteroscopy. I missed that question. There's a question here on Instagram. Can one have PCOS and still have hypolactin? Yes. Cheers the cherry. Someone can have high PCOS and they can still have hypolactin too. Somebody, MRM Suzette is saying, MRM Suzette, you're always asking questions. Wonderful lady, you're always attending here. Thank you. You said you've done HSG, ovulation monitoring. Doctors say your eggs are not growing. No infection was found. If you've done HSG, your eggs are not growing. You might need egg donor, to be honest. What is the cause of frequent infection after proper treatment? Probably your hygiene is not excellent and it's causing you to have recurrent infection. Probably you need to change your pants. Probably you need to change your pads, or probably you need to wash and iron dry all your pads. Sir, how can one get rid of Asherman syndrome? We do hysteroscopy and we take away the scar tissue in the womb that is causing the Asherman syndrome. So, Totos and Peter, to get rid of Asherman syndrome, we put in a camera hysteroscopy into the womb and we resect all those scar tissue that are causing the Asherman syndrome away. We take them away from your womb cavity. What causes less flow during periods? Probably you have blockage in your cervix, what we call cervical stenosis. Probably you have fibroids or polyp on your cervix, or probably you have Asherman syndrome, or probably you're not ovulating, or probably you've gone through premature menopause. That's why you might be having scanty period. On Instagram here is a question. Someone is saying that, can vaginal size, shape, or location determine chances of conception? Absolutely no. The vaginal size, the vaginal shape, it does not cause infertility at all. What can cause delay menses? If you have hypolactin, hormonal imbalance, you are going through menopause, it can cause delay periods. Or if you're pregnant, someone is asking, between hysteroscopy and laparoscopy, which one is important? There's no important one at all. It depends on what you are being investigated for. So hysteroscopy, laparoscopy, none of them is important than the other. It depends on what you are being investigated for. That will determine what test we are going to use. What you're being investigated for will determine what sort of test we do between hysteroscopy and laparoscopy. But laparoscopy is done while you are asleep. Hysteroscopy can be done while you are awake. It can also be done while you are asleep though, but we can do hysteroscopy, what we call office hysteroscopy, while you are awake. Victoria is saying that she was told that she had Asherman syndrome. She did hysteroscopy. We need to do, how painful is it? Okay, if I do hysteroscopy, how painful? Hysteroscopy, the one we use, the machine we have in ATG IVF center is very, very tiny. It's like a fiber optics, and it's so tiny you hardly even notice it entering your womb. And with good lubricant, you not feel it at all. It's so tiny and it's very, very comfortable. And in fact, we give you some light anxiolytic to calm you down before the procedure. Like, how much can it cost to get rid of Asherman syndrome? Hysteroscopy, to get rid of Asherman syndrome, you need what we call operative hysteroscopy. Which we can do for you at the ATG IVF center. The equipment comes in 2 weeks' time, okay? And in Lagos and in Warri, that I know, in Abuja too, it costs you between 250 to 330,000 naira. Between 250 and 350, yeah. So in Lagos, most places in Lagos, they will charge you 300 for hysteroscopy, okay? What can be done to prevent miscarriage against rhesus factor? You need to see the hematologist for that. What can cause pregnancy not to progress at 4 weeks, just seeing pregnancy sac alone? It could be chromosomal abnormalities, it could be implantation problems, it could be infection, but in most cases, it's chromosomal problems that are not known to repeat themselves. Doctor, does hysteroscopy take care of something in the uterus? Ajon. I don't know what you mean by ajon in the womb or ovary. I don't know what that. Beauty Abudu. What do you mean by ajon? I don't know what you mean by ajon. Is that French or is that Spanish? I don't know what that is. How much is hysteroscopy? Ladi Empire is saying, how much is hysteroscopy? Hysteroscopy is between 250 to 350, depending on where it is in Nigeria. Good evening, sir. Whenever I press my breast, it brings out water. Go and do your prolactin. So you bought Alalade. Why will you take Alalade? Before you take Alalade, you must do prolactin test. The reason is that while you are taking the Alalade, you want to know and have a baseline before taking medication so that you can monitor the progress of your prolactin. So before you take Alalade or any tablet for high prolactin, first of all, check your prolactin level. Because prolactin level is important to check before taking any medication. So at least you know what the value was before starting taking the Alalade, so that you can know and track it if it's coming down and if it's responding to the palo there. So if you want to treat your prolactin, just go to the ATG IVF center there. I've given the doctor there instructions on how to treat and correct your prolactin, okay? Doctor said adjourn in the wheelchairs, like, well, I don't know what you mean by adjourn. Adjourn is not a medical term, my beauty sister. I don't know what is adjourn. I'm a doctor, I don't know what adjourn. I don't know this language you're speaking. You did fibroid surgery for 4 months now. You still having pains around your tummy. What could be the cause? It could be Asherman syndrome. It could be scar tissue in your womb. It could be ovarian cyst. So get a scan as soon as possible, okay? Okay, thank you everyone. I'm waiting for more questions and I'm going to close out this topic. My mouth is getting dry. I need to go and chill out. Okay, thank you everyone for being here today. I appreciate you all. So see you soon and God bless you. See you tomorrow. All things being equal by the grace of God. I love you all and I love myself too. Thank you. Oh, someone is asking, do you do karyotyping in your center? Yes, we do. Adamaze, we do karyotyping. The cost, honestly, I don't know it in my head. But if you call the lab tomorrow, Nike, the lab manager, has the full details and all the costs, and she's going to go through it with you. Enregem Suzette, you want to talk to me one-on-one? Please go through our premium services. But please, Christina or Gloria, can you please give Enregem Suzette our link? Thank you, Christina, for giving Enregem Suzette our link to join the premium services. If you want to do your hormonal profile test, if you want to see our doctor for consultation for infertility at the ATG IVF Center, please call Nike tomorrow morning and go to the ATG IVF Center, and the doctor there will consult with you regarding your IVF situation, regarding your infertility situation, and will tell you what tests to take, get them done as soon as possible, and then we can fix your infertility. So if you want to be seen by a doctor to consult with you, to do your scan, do your hormonal profile, get things sorted out, you can go to the ATG IVF Center tomorrow or call the ATG IVF Center and she'll go through it with you. Now, at the ATG IVF Center, we're working on different ways to reduce your IVF cost. So we've tried to separate the IVF cost and the pharmacy cost to bring down the cost of IVF. But to be honest with you, if you want to do IVF now, get registered today or call the IVF Center tomorrow, and Nike will go through information on the cost of IVF so you can get it done as soon as possible, because prices are increasing now. The dollar is not favorable for the naira, because naira is being bad, it's a bad thing like that, no? Yeah, it makes the cost of our treatment, IVF medications imported, to be expensive. So if you want to get IVF done, now go and get registered to the ATG IVF Center tomorrow. First thing tomorrow morning, call and get registered, okay? Hope to see you all. Love you all. Bye-bye. Have a wonderful day.